Hello, my name is Tristan, and this is the drawing up skills video. I want to make sure that before I begin, I have all my supplies. I have my gloves, hand sanitizer, and for the purpose of this video, for the needle receptacle, it's a water bottle for right now. Have my needle, my regular dose of insulin, and my NPH or intermediate insulin, along with the alcohol pad and gauze, and I think that's my needles as well. The next thing I'm going to do is I'm going to verify our provider's orders in the EHR, and then I'm going to verify the patient's rights, which is the right patient, the right drug, the right dose, right time, right route, and the right administration. Once I verify those pieces, I'm going to go and compare the provider's orders in EHR to the MAR. And in the MAR, we have 4 units of insulin that we're going to administer to the patient, along with these are 4 units of insulin, along with 8 units of NPH or intermediate insulin. Once I got that, the next thing I'm going to go ahead and do is once those are done, those checks are done, I'm going to go into the patient's room. And once I walk into the room, I'm going to make sure I use proper hand hygiene. I'm going to introduce myself to the patient. Hello, Mr. Ramirez. My name is Tristan. I'm here to administer insulin, your medication. Can you please tell me your first, last name, and date of birth? Okay, thank you. I got the 2 patient identifiers. And then I'm going to ask if he has any allergies to food, medications, any substances. No, perfect. Okay, so insulin, I'm gonna let him know what I'm doing. So I'm gonna be administering insulin. It's only gonna take a couple minutes. What the insulin is used for, it's for diabetic management. It helps glucose go into the cells to help expend energy. Okay. Some common side effects are dizziness, nausea. Some adverse side effects can be severe hypoglycemia, which is very low blood sugar, and potential hives. Okay, which means you're having an allergic reaction. If you're having any of those type of symptoms, please let me know, as they're more serious. As with any injection, you can feel slight burning or stinging sensation at the injection site, but those should resolve here shortly. Do you have any questions for me? No? Okay, great. Thank you. Okay, also I checked your your glucose level. It is at 160 levels, which is an appropriate level to receive insulin. Your next meal will be, so I could provide the insulin before your next meal, which is going to be breakfast, and that should be in the next 30 minutes. I'm going to have another nurse come in and verify with me, along with in the EHR and the MAR, and we're going to have what we need, which is 4 units of the regular insulin, and then 8 units of the NPH, which is or intermediate insulin, which ends up being a total of 12 units of insulin. Okay, all right, thank you, nurse. I appreciate your help. Okay, now once that's all said and done, I'm going to go ahead and proceed, and I'm going to put first my I use hand hygiene, hand sanitizer, and then my glove. I'm going to go ahead and put some gloves on. Okay. All right. Okay, so first thing I'm going to do is I want to make sure that when I look at the insulin, I'm going to make sure that both of the bottles are not expired, so I'm going to look at the expiration date, and it looks like the expiration date is okay. Also, the regular insulin is going to be clear, and then the NPH is actually going to be a little cloudy, which you can see here. And these two are both refrigerated, so basically what I want to do is I want to take them out and I want to put them between my hands, let them roll between my hands for a bit, just kind of mix in the solution. It's like this, okay. All right, just like that, okay. And then once that's done, the next thing I'm going to go ahead and do, I'm going to get my alcohol swab. I'm going to take the tops off like this. And clean the top of the vial off on both of them, just like this. Okay, and then once that's done, I'm going to allow this to dry, and while that's drying on the top, I'm going to go ahead and I'm going to take out my needle. So this is an insulin needle, which is 100 units, the 29 gauge. Okay, and so with the cap still on, what I'm going to do is I'm going to draw up 8 units of air. And bear with me, because this particular type of one here, it moves really easily. Okay, so I got my 8 units of air right here. I don't know if you guys can be able to, kind of be hard to see, but got my 8 units of air. And then I'm going to insert this after I'm going to take my cap off. Insert this into my NPH bottle here. Okay, and I want to make sure when I insert it, I'm not going to get any medication. Just inserting the air like this. Okay, once that's done, okay, I'm going to go ahead. I'm going to pull out the needle, okay, and then I'm going to pull up 4 units of air here. Okay, you can see there's 4 units of air there. Okay, and now I'm going to insert this into the regular vial. Okay. I'm going to push this down, okay, and then insert the air, and then I'm going to invert it. I'm going to invert this, and I'm going to draw up 4 units of regular insulin. I want to make sure there's no bubbles. 4 units here, okay. So once I do that, I got the 4 units of regular insulin. Now I'm going to verify against our MAR, okay, to make sure that we have the correct dose here, okay, of the regular insulin, and then I'm going to check that to see what to check that with the regular MAR, and then okay, so I gotta make sure combined dose until, okay, so I have 4 units of the regular insulin. I want to combine that with the EHR into the MAR, okay, to make sure this is the correct dose. And now the next thing I'm going to do is I'm going to put this into, I'm going to get the NPH, okay, and I'm going to put this into the NPH vial, okay. I'm not going to inject anything, okay. I'm just putting this in here. I'm going to invert it like I inverted the regular, okay. And after I invert that, I'm going to get 8 units. Eight units of the NPH. So that should give me 12. And I'm still checking for bubbles to make sure there's no bubbles as well. And I got my 12 units. I'm gonna take that out. So I have my 12 units of the NPH or intermediate insulin. So I have the 4 units of the regular insulin, 8 units of the NPH or intermediate insulin, and that should combine for what the provider's orders of an EHR on the MAR of 12 total units, okay? Now that I was able to do that, what I'm going to do is I'm going to use, I'm going to go ahead and recap my needle, and I'm going to do that with, by putting the needle into the cap here without touching it, okay? Just like that, all right? Now, I'm going to, after I check the MAR to make sure it's set, the next thing I'm going to do is insert this to the patient, make sure, administer the needle to the patient, the medication to the patient. And once that is done, I'm going to go ahead and take off my gloves. I'm going to make sure I use the proper hand sanitizer. Then I'm going to go ahead and document in the EHR MAR exactly what transpired with the right patient, the right drug, the right dose, the right time, the right route, and then right administration. And then I'm going to make sure I check back in the patient and make sure that there was no side effects or adverse effects. He seems to be good. Then I'm going to make sure that the patient is comfortable. Make sure I give the patient the call light. Ask the patient if he has any type of questions, and if he does experience any of those type of side effects or adverse effects, to please let me know immediately. And then the next thing was, and that's it. And then I'd go ahead and go out the room, and that's it. Thank you.